Hi guys. The group that I decided to do my discussion on this week is the obese patients that are, or patients that are characterized as obese based on their BMI in our chart. This group of individuals was the first patient population that I considered when thinking about patients who healthcare providers often see as difficult or non-compliant or that their condition is their own fault. And I think that it's common to see weight bias within the healthcare system, and providers are often making assumptions and creating a mindset based off of BMI before they even see their patients. This patient population, like I mentioned earlier, is labeled as being non-compliant, and misconceptions regarding their health that they don't care or they're not willing to put the effort in to get healthier. In a literature review that was conducted in 2015 on weight bias in the healthcare field by Solomon 2022, this article found that healthcare workers and providers had strong negative attitudes and stereotypes regarding patients that fell into the obese category. As a result of these negative attitudes and stereotypes, I believe that this patient population is not treated equally when compared to patients that do not fall into the obese category. The individual effects, I think, are substantial, and as described by Dr. Greibler 2020, weight bias negatively impacts patient care because these patients become less receptive to the healthcare provider's treatment plan that they have for them. And because of this causes patients to avoid doctors and medical professions altogether. This is in an article by Fenold 2023. And I mean, if you just put that into consideration, if you go into the doctor's office and automatically assumptions are made based on your weight, and you can tell that the doctors aren't as interested in helping you because they feel that you don't do enough to help yourself, can you see how frustrating that would be for the patient and how that could turn them off from the medical field altogether just because of that one experience? They're not going to seek care from additional medical professionals. So I think that's why I picked this patient group, that I feel strongly that this is a problem within our healthcare field. That Solomon 2020 article that I mentioned earlier also determined that the biggest effect on this group of individuals as a whole is the fact that these physicians admitted to spending less time in appointments with the patients that were considered overweight, which that alone right there just speaks volume that this is a problem within our healthcare field. If our providers and our nurses are spending less time with patients that are characterized based off their BMI as being overweight or obese, and not spending enough time building that therapeutic relationship and hearing the patient's concerns, that's a huge problem. And like I mentioned earlier, this really discourages these individuals based on this one experience to seek other healthcare professionals' opinions or have this now they have this negative view on the healthcare. This stigma or bias also negatively impacts healthcare providers because they are unable to develop the therapeutic relationship with their patients. And by doing this, we are breaking our duty to do no harm with our patients. Before my experience working in the hospital and enrolling in this nursing program, I feel like I had similar biases about patients that were characterized by their BMI as being obese. I saw these patients as non-compliant and difficult to take care of because of what I thought was a lack of motivation to be healthy. But I quickly realized and learned that my beliefs regarding this population were untrue completely, and that I was guilty of holding a weight bias. Instead, I learned that all patients are different, and it is important to understand that each patient needs a personalized treatment plan that is specific to their needs. And this is got to be put in priority instead of just simply thinking that our patient or telling our patients that they need to eat better or exercise more often. During the last few years of working in the hospital and going to clinicals, I've witnessed weight bias way too often. I've heard many staff members during just patient handoff report comment on patients' weight and their lack of caring to be healthy. And that's just assumptions that people made just by looking at patients' charts and their BMI and being categorized as overweight. And that's not it has nothing to do with going in and having a conversation with these patients. And I recently had a staff member that I work with comment on or question why this patient continues to seek help for problems that her lack of care caused, and if that patient had simply just focused on eating better or losing some weight, she could avoid coming to the hospital altogether. And unfortunately, I'm sure that bias that this nurse had affected her patient care, and I'm sure it negatively impacted the patient. Recently, I just went in and had a yearly physical exam with my provider, and I had normal blood work drawn. A couple weeks after, I got a call with my results of my blood work, and my cholesterol came back high. And instead of the nurse who called me or my PA that I see taking a deeper dive into understanding why my cholesterol was high, possibly because I'm a nursing student and we have a lot of stress in our life, and I probably don't take the time as much as I need to control my cholesterol. The nurse just simply told me that this high cholesterol was because of my recent transition from a healthy weight to being categorized as overweight, and that I needed to focus on exercising more and eating a more well-balanced low cholesterol diet, which was really discouraging. In the article by Kurowski, 2013, The Origins of Bias, he talks about one of the type 1 processes being that developed through implicit learning, and that he describes the big role of learning in this development of our attitudes and our perceptions. And by spending time in an environment where individuals hold certain biases or stereotypes, we're implicitly, without our intent or conscious awareness, acquiring these same biases that these people hold. And I believe that this is the origin of how weight bias happened. In the other article, Madden 2020, marginalization refers to the idea that specific other patient populations are treated as insignificant or lesser importance than patients not in that group. And they talk about when strategies to address how to deal with complex patients who are categorized as difficult or non-compliant, which is similar to the obese patient population that I was targeting for this discussion. And they propose the idea of interprofessional outpatient intensive teams. And one of the key approaches within these teams is the non-judgmental approach, where there is an actively positive and accepting approach towards patient care and not just simply the absence of judgment. And that is Madden 2020. If I were able to initiate change within the healthcare community, I would first focus on education. I would start educating on weight bias as early as elementary school, because we all know that the healthcare field is not the only setting that people experience weight bias. However, I think that more education is needed in implementing this weight bias and its effects on patient care in nursing, medical, dentist, any other healthcare educational programs, to try and bring light to the severity of this bias and how it affects our patients. Next, I would try and advocate educate the patient on the importance of being their biggest advocator. Patients need to advocate for themselves. They know their bodies, they know what's going on better than any of us do. So if they feel that something is not right, they need to stand up and say something about it. In that same article, Fenold 2023, Dr. Greibler explains how in life, we all go through bad experiences at some point, whether it's at the grocery store or it's at buying a car at a car dealership. But these experiences can't impact how we choose to move on with the rest of our life. And the same can be held with the medical field. If these patients experience weight bias by one provider, as unfortunate as that is, they need to take that as a learning experience, advocate for themselves, find a new provider, and hopefully use that as motivation to put them on the right path towards patient care. So it's important for them to not give up on their health based on one bad experience. Thanks.